Hi, I'm Dr. Myers, and I'm here with my patient Wanda, who is 3 months out from a bilateral shoulder stem cell procedure for arthritis. Before we talk to her, we're going to take a quick look at her x-rays and see what kind of issues she was having in her shoulders.
Okay, looking at both of her shoulders, this is her left shoulder and this is the right shoulder, looking straight on at both of the shoulders here. If I zoom in on the right shoulder, you can see a little thin wisp of dark space between the ball and the cup. This is her amount of joint space left, the cartilage thickness left in the joint. She's almost completely bone on bone with a large bone spur at the bottom of the joint. Switching to this left shoulder, if I zoom in, there is no cartilage space left. She is bone on this left shoulder joint.
Okay, so thinking back to before your procedure more than 3 months ago, describe your symptoms with the shoulders. What kind of issues were you having? What kind of pain were you having with your shoulders?
Well, I had pain anytime I used my arms. You know, when I was using the computer, when I slept at night, mostly that's when it bothered me. When I would try to carry something heavy, they just hurt whenever I did anything.
And the pain, was it more mild, moderate, severe pain with these activities?
It was mostly severe.
And what kind of treatments had you tried for your shoulder pain before we visited?
I had injections.
Steroids?
Yes, and I didn't even feel them. They didn't even help the pain at all. And then I had just pain pills.
Why ultimately did you decide to go through a stem cell for your treatment on your shoulders?
Well, I just heard about it, and I came to a meeting, and I heard the people on the little TV thing that you had telling how good they felt now that they had had the stem cell growth, and that it really works, and they would recommend it for anyone.
So here we are 3 months down the road from your procedure. How do you feel like you're doing?
I think I'm doing marvelous. I'm just real happy with it.
How's your pain level in your shoulders with normal activities?
Oh, it's about, you mean a 1 to 10?
Or mild, moderate, severe, or is there pain
okay.
with normal activities?
It's not severe, it's kind of mild.
And overall, compared to before your procedure, thinking about your symptoms at this point in time, 10% better, 50% better, 80% better, 90% better? Put a number on your improvement.
I would say 60 to 70% better.
How is your pain with sleep? You're having quite a bit of difficulty before. How's your pain now with sleep?
I sleep very well. My shoulders don't bother me at night usually they hurt me when I would turn from one side to the other, and now I can do that without any pain.
Are there other activities that you have found to be easier to do that you couldn't do before?
Well, like dressing, putting clothes on, and trying to carry something heavy, that would bother me too.
So less pain with those activities.
Yes.
At this point in time.
Right.
Very good. Well, here we are 3 months down the road. Do you feel like you made the right decision with your treatment?
Oh, yeah. Yeah.
Very good. Well, thank you so much for coming in and sharing your story.
Right. Thank you.